Hello, I'm Nilufer Ertekin-Taner. I'm a neurologist who sees dementia patients, and I'm also a neuroscientist focused on the genetics of Alzheimer's disease and related dementias. Currently, there's more than 5 million individuals who are afflicted with this condition in the United States, and more than 30 million individuals afflicted with Alzheimer's disease throughout the world. And the prevalence of this condition is going to keep increasing with the aging population. Florida Department of Health Ed and Ethel Moore Alzheimer's Disease Program began funding grants focused on dementias, especially Alzheimer's disease. And researchers and clinicians at Mayo Clinic in Florida have been fortunate to be recipients of this grant since the inception of this program. This year, we were fortunate to have 8 individuals funded by this program. And this funding will enable us to expand the research on Alzheimer's disease. So Alzheimer's disease is an epidemic. It does not have a cure, and we are in desperate need of identifying drugs for this condition. We are in desperate need of identifying novel biomarkers to be able to diagnose this condition early on. And we are in desperate need of finding preventative measures for this condition. The funds provided by the Florida Department of Health will enable expansion of research in each of these different areas. The funds are provided to researchers who are at the earlier stages of their career, as well as established researchers. In my opinion, it's tremendously important to fund individuals across this whole spectrum. This is a complex disease, and it needs a complex, team-based, multiple expertise, multidisciplinary approach. We are fortunate at Mayo Clinic to have that team and to have that infrastructure. We're also very fortunate to have the trust of our patients who participate in our research studies, without whom these studies could not be done. At Mayo Clinic, we're very fortunate to have both physicians and research scientists, as well as health personnel, very focused about managing patients with Alzheimer's disease and finding a cure for Alzheimer's disease. Some examples of activities to keep the mind sharp, as it were, are brisk walking, 30 minutes a day, doing puzzles, socially engaging with others, friends, family members, reading, playing the piano, things that are pleasurable, but also that work your body and work your mind. These would be some examples of activities individuals can do.